Please stay around for the questions and answer period. So now we're going to get to many of your questions. And I want to thank all the panelists for doing a tremendous job of their very insightful, very timely and relevant comments. I'm going to field some of the questions that have been asked. Feel free to add some additional ones while we're talking here. And I'm going to just ask some of the questions and see which panelists feel like they're in the best position to be able to respond. So the first question from the audience is, has the CDC Foundation reported descriptive data on the number and types of positions they filled at the federal, state, and local levels during the pandemic? Wondering if any of the audience members might know that. I'm sorry, any of the panelists might know that.
I'm sorry to say that I don't know that answer. There's been some provisional data collected by NACCHO as part of this. That's, I think, going to go live relatively soon. I think they're working on a report related to changes in workforce. I know there's been a lot of financial data posted, but I haven't seen anything coming out of CDC other than kind of specific, at this organization, we're doing this kind of program. I haven't seen it foundation-wide, but that might be me missing it. I don't know if others have seen something.
Maybe I can just add that this just points more to a broader challenge of tracking the health workforce broadly, let alone the population health workforce. I think JP and his team, among others, have tried very hard to articulate the different kinds of the public health workers we have in the federal government, state government, and county and local city governments. However, more broadly, we have a hard time tracking who is actually conducting what type of work. We're very good at counting people by occupations and maybe head counts, but actually understanding what people's roles are, like that's a very tricky thing to do, which makes it difficult for us to then understand, do we have enough people addressing the issues of population health? So I just want to add that.
And that's absolutely critical. And also being able to do that on a federal level, enumerate the public health workforce as well as on state and regional levels, because that's part of the making the case for resource investment and for policy change to support that, is being able to define the need and make the case, and also to point out to people that are coming into the field, where are the opportunities, what are the needs, and how do you pursue them? Do you see anywhere where that's, I know we have public health wins, which has been a great progress. Is there anywhere else where we're making some progress towards a more clear enumeration of the public health workforce and the needs? You see anything else happening there, or is there anything you'd recommend?
Well, I would say there's some work underway within NNPHI and our work with CDC on a project called Project First Line, which is COVID focused, but it's IPC focused. And our goal has really been to identify where the public health workforce touches infection prevention in the healthcare sector. And that has been a journey to try to find those touch points, and lots of back and forth conversations around that. So I do not have an answer to your question, but it is a very important question, and one that I think right now the field is really struggling with figuring out exactly who's doing what in public health, and the differences we see across states and localities and how that work is getting done.
The last large-scale enumeration of governmental public health is almost 10 years old, and a couple things have happened since then. As Bianca pointed out very rightly, there's this idea of doing occupational-based assessments within public health, as we've seen in other types of health workforce assessments. And in public health, it doesn't work quite as well for a couple technical reasons and a couple practical reasons. So practically, because we are a field and not a discipline, we have many, many, many kinds of workers. But the way that the federal government tracks labor statistics doesn't really include health departments. So we know how many folks work in dentist's office and what kind of folks work in dentist's office, and we don't know that through the federal government in public health. Moreover, to Bianca's your point earlier, we see substantial variation by what kind of staff do similar tasks or similar functions at the state and local level across the US. So within, say, communicable disease control or environmental health, you might have certain kinds of folks doing inspections in one state and different licensure requirements or kind of historical norms or conventions. And you have different kinds of staff doing the same thing or similar things in other states. And that makes it exceptionally hard to figure out how many staff do we have, how many staff do we need, and what should they do.
If I could just add, I think forums like this is a great start to us having this conversation to define what are the workers that we really need to address key issues in population health. And because what this is doing is to help increase the visibility of a broad range of jobs that can address population health. And I think we are seeing these types of activities being done within different professional societies, like the American Public Health Association. They're probably working hard to make sure that they can identify the workforce that is needed to directly address public health. We have the clinical lab worker field, the different professions doing work to articulate career pathways into their field. And then in addition to this, I think many states are working hard to bring together employers across industries to have these kinds of conversations. I know here in Washington State, we have something called Career Connect, which has brought together industry partners from all different kinds of sectors, not just healthcare, but to have these conversations about what are the jobs that are actually available and what kind of training do we need. And it does require coordinated effort between the employers and the universities, community colleges, and other kind of training programs out there to have these conversations. And I think we need to do this more. I think that's all I can say is we need more of these kind of opportunities to bring people together. And this is a great first start.
Agreed. Thank you. A question from the audience that I think kind of aligns with your last comment, Dr. Frogner, is in most states, EMS, emergency medical services folks, fall under public health in some capacity. Has there been any consideration of claiming them as public health providers and looking at their role in a more broad way about impacting population health?
I think EMS providers are certainly providing public health services, whether they know it or not. And it goes back to that earlier point of this question of, are people aware that they're part of the population health workforce or public health workforce? And I think to some degree, we need to call out what we think public health work looks like and what population health looks like, because I think even in this conversation, we need to have more clarity around where those lines are, if there are any that we need to really distinguish. And just to add, the EMS professions is even grappling with the fact that there are these community paramedics that are doing more of that on the ground work, and that's more a newer title that but is more with the idea that you actually provide the care in the community rather than do the transporting part, which is what EMS providers, I think people typically think about, is that they're in the ambulance, picking up the patient, bringing them to the hospital. But many of them are actually responding to mental health calls. And then I think the desire is to try to make sure we have a reimbursement system that allows them to actually provide the care in the community rather than just pay them for transporting people.
I agree with that 100%, Bianca. And I also think that as we think about community health workers and better integrating them, our EMS, that's a pipeline, that's a pathway to public health. If we get them early enough and talk to them about the work they're doing and explain how their work impacts public health, that's a pathway to getting people through a career trajectory in public health and can provide a nice long career doing a wide variety of things, starting with EMS. I know some folks that work in public health who started as EMS people early right out of high school, and then moved into public health. So that's a pathway for sure. And there's certainly been some conversations around, I think, I've seen some conversations around better including EMS in conversations around the public health workforce, but I've not really been involved in those conversations.
Thank you.
One kind of technical, but really key point here is that definitions really matter. So as was brought up, some folks count EMS within public health. Some people count them more broadly in public safety. And whether you include them or not is actually a swing of tens of billions of dollars in public health spending. It's one of the few areas where the Census Bureau, when they track how much is being spent where, kind of says, well, it doesn't so much depend on the function, but on, is EMS in fire or public safety versus in public health, that's where you count it. That's one of the only places where that's true. And it speaks to how hard it is to even know who's doing public health work where. It's kind of shocking that we don't know that nationally.
Yeah, And as you mentioned, it then underpins where funding gets allocated and doesn't, and impacts the entire workforce that we're trying to develop. Well, with that, I want to say thank you to NASCM for this opportunity to have this really important discussion. I agree with Dr. Frogner that we want to have more of these discussions to really move the needle on public health workforce. I want to thank the panelists for their really informative and energizing remarks, and for your leadership.